Most of us hope we'll never see a medical emergency in real life, but what happens when we do? Today we're talking about something every single person should know. What to do when someone has a cardiac arrest. Not heart attack, not feeling unwell. A cardiac arrest, when the heart suddenly stops beating. And we'll cover what cardiac arrest actually means, why the first minutes matter more than you think, what the current UK statistics tell us, what you can do before the ambulance arrives. What is a cardiac arrest? A cardiac arrest happens when the heart stops pumping blood. When this occurs, the brain stops getting oxygen. Consciousness is lost quickly. Breathing is absent or abnormal. The clock starts ticking immediately. If blood isn't circulating, organs begin to fail within minutes. This is not just feeling faint. This is life on the line, and your actions matter. Cardiac arrest versus heart attack. Important distinction. A heart attack is when blood flow to part of the heart is blocked. You might feel chest pain, discomfort, sweating, nausea. A cardiac arrest is when the heart's electrical system fails. There may be no warning, there may be no pulse, there may be no breathing. Heart attacks can sometimes lead to cardiac arrest, but cardiac arrest can also happen unexpectedly in otherwise healthy people. UK statistics, what the numbers tell us. Let's look at some facts. In the UK, there are over 30,000 out-of-hospital cardiac arrests every year. This is based on the most recent data from national registries and NHS reporting. Out-of-hospital cardiac arrest. That means someone collapses at home, at work, at a shop, on the street, not in a hospital setting. Of those 30,000, only around 1 in 10 will survive to leave hospital. Those who survive tend to be the ones who got immediate action. That's not because ambulances are slow, it's because time matters more than equipment. Why the first minutes matter. Every minute a heart is not circulating blood, the chances of survival drop by 10%. If no CPR is given, after 4 to 5 minutes, brain damage becomes highly likely. After 10 minutes, survival is rare. Ambulance response times vary, often 8 to 12 minutes in urban areas, sometimes longer in rural areas. That means the bystander, the person on the scene, is often the most important factor in those first minutes. So what can you do? Simple steps. If someone collapses and is unresponsive, 1. Check for danger. Before you help, make sure you are safe. Traffic, wires, hazards. Don't become a second casualty. 1. Check response. Call their name, gently shake their shoulders. If they do not respond, 1. Check breathing. Look, listen, and feel for breathing for no more than 10 seconds. If they are not breathing normally, 1. Call 999. Put your phone on loudspeaker. Tell the operator, I'm with someone who is not breathing. The call handler will guide you every step. 1. Start chest compressions. Place the heel of one hand in the center of the chest. Place your other hand on top. Push hard and fast, about 2 compressions per second. Hard and deep enough to pump the heart. Keep going until help arrives or the person starts breathing. Defibrillators, what they are and why they matter. Automated, external defibrillators, AEDs, are devices found in public places like shops, schools, offices. They are easy-to-use voice-guided designed for anyone to operate. When you switch an AED on, it talks you through the steps, it tells you when to press a button, it analyzes the heart rhythm and only shocks if needed. You cannot make things worse using an AED. That's why early access is so vital. Why training matters. This isn't about being a medical professional. This is about confidence. CPR and AED training removes fear, reduces hesitation, empowers action. Even a short course can make you the person who doesn't freeze, but steps up. Breaking down the common barriers. Many people tell us, I'm scared I'll do it wrong. I might hurt them. I wouldn't know what to do. I'd panic. Here's the truth. Doing nothing is the biggest mistake. Chest compressions save lives. Emergency services guide you, in real time. And every trained bystander multiplies survival chances. This is bigger than you think. Cardiac arrests happen. At home, at work, in shops, on the street, around people just like you. Most of the time, someone nearby is the first potential responder. You could be that person. Your mindset matters. When someone collapses, don't wait, don't hesitate, do something. Because your action, not perfection, saves time. In emergencies, timely action gives time back to the heart. In summary, cardiac arrest can happen to anyone. Every minute without action reduces the chance of survival. Early CPR and defibrillation are proven lifesavers. You don't need to be a professional, you just need to act. Closing call. If you learned something today, please save this video, share it with a friend, with your family, with someone you care about. Because awareness spreads and action saves lives. Remember, before the ambulance gets here, what you do matters. Thank you for watching.